Good afternoon, dear colleagues. My name is Katja Weisel. I'm from the University Medical Center in Hamburg-Eppendorf in Hamburg in Germany. And I was very pleased that I could present in behalf of all my co-authors the efficacy, safety and determination of the recommended phase 2 dose of ABBV-383 BCMA bispecific antibody in patients with relapsed and or refractory multiple myeloma. So ABBV-383 is a BCMA CD3 bispecific antibody, and it has a very unique design. When you look on the figure, you see a bivalent BCMA binding domain, and this is designed for high avidity binding to target cell surface BCMA. And you see a low affinity CD3 binding domain, which is designed to mitigate cytokine release and has also the potential for minimal T-cell exhaustion. And you have a silenced Fc tail, which allows, with an extended half-life, Q4 week dosing. And we presented at this convention after it was already shown that this bispecific antibody is as a monotherapy effective in relapsed and or refractory disease, safety and efficacy results from the phase 1 trial supporting 60 milligram Q4 week as the optimal therapeutic dose. This is the trial design. Patients with relapsed and or refractory myeloma who received at least 3 prior lines, including proteasome inhibitor, immunomodulating agent, and anti-CD38 monoclonal antibody, could be included in the trial. ABBV-383 is given IV. There's no step-up dosing, and it's a fixed dose. Study objectives were primary safety and secondary efficacy. After the classical 3+3 dose escalation, there was a monotherapy dose expansion, and we here focused on the 40 milligram Q3 week, the 60 milligram Q3 week dose, and the 60 milligram Q4 week dose. In the 60 milligram Q4 week dose, there was an optimized pre-medication schedule and a reduced hospitalization time. Patients had only come for 24 hours after the first dose to the hospital. Here are the patient characteristics of this trial. So median age was 68 years. We had a wide range from 35 to 92. 17% of patients who were enrolled in the study were Black or African American. Patients were about 80% triple class refractory, and nearly all patients pentadrug exposed. A significant amount of patients had extramedullary plasmacytoma. Oops. Sorry. So with a median duration of follow-up of 20.3, 32.3, and in the Q4 week cohort of 12.1 months, in the latter cohort, nearly half of the patients were still on drug. Primary reason for treatment discontinuation was disease progression. There were a few TEAEs leading to study drug discontinuation. 3 patients experienced such TEAEs in the Q4 week dosage arm. However, overall, there was a good and manageable safety profile. In the 60 milligram Q4 week ABBV-383 cohort, the rate of grade 3/4 neutropenia was 29%, and the overall CRS rate was 43%, and we come to that in more details in the next slide. The incidence of grade 3/4 infection was 19%. Here you see the details on the CRS. 43% in the 60 milligram Q4 week cohort experienced a CRS, 38% grade 1. The onset of CRS typically occurred on the same day and did not reoccur. Responses to ABBV-383 continued to deepen with longer follow-up and were very robust, within the 60 milligram Q4 week cohort an overall response rate of 65% and an equal or more than VGPR rate of 55%. Median time to first equal or more than VGPR was 1 month. After this median duration of follow-up in the Q4 week cohort of 12.1 months, the median duration of response was not reached. The 12-month median duration of response in patients who had a PR or better was 83.9%. In this heavily pretreated patient group, the median progression-free survival was not reached in the 60 milligram Q4W cohort, and the PFS at 12 months was 54.8%. So in conclusion, the optimal therapeutic dose of 60 milligram Q4W ABBV-383 monotherapy resulted in promising efficacy with deep and durable responses. The overall response rate was 65% and equal or more than VGPR 55% in the 60 milligram Q4W dose cohort. Median duration of response and median progression-free survival were not reached. Patients treated with 60 milligram Q4W ABBV-383 had a lower incidence and severity of CRS compared with the Q3-week dose cohorts. The extended interval of Q4W with a shortened CRS monitoring period in cycle 1 is designed to improve convenience and to reduce treatment burden for patients. And the registrational phase 3 Cervino trial already started recruitment, investigating this monotherapy in randomized comparison to standard of care treatments. Thank you very much.